Hi, I'm Dr. Mary Wiechart. My partners and I want you to know that we take your children's oral health very seriously. As a matter of fact, we begin to think of your children's oral health even before they get teeth. Believe it or not, tooth decay has become the most common chronic disease in children. That's why, even at a very young age, it's important to get in the habit of taking care of your little one's oral health. Take, for instance, this little guy Wilson. He's only an infant, but it's important to make sure after each feeding or spit up, I wash my hands and wrap a piece of gauze around my finger, dampen it with water, and move it over his tongue and top and lower gums. As you can tell, even Wilson didn't really like getting that done to him, but it's important to create the routine as young as possible so that once they're older, it's just part of their normal day. Those baby teeth work as, I like to think of them as bench warmers for their adult teeth. And if you don't keep those baby teeth healthy, then their adult teeth won't come in properly or form properly. And so you could be affecting their oral health for the rest of their life by not taking care of their baby teeth.
As Dr. Wiechart just showed us, getting our kids into a routine at an early age is essential to their oral health. Most children are ready for their first dental visit at the age of 2 or 3. These early visits are vital to kickstarting preventative care that keeps oral disease at bay. For my elementary age children, I make sure they are brushing twice a day, rinsing, and using a pea-sized amount of toothpaste each time they brush. Watch your children brush if they're under the age of 6 and help them until they've mastered good brushing habits. We understand too that as your children age, schedules get very busy as parents. As your children grow and become more independent, it's important to keep the momentum of brushing twice a day, introducing flossing once a day, and limiting sugary drinks and snacks. I think the best way to prepare a kid for a dental appointment is to have them come along to a visit. We have lots of parents, that's what we recommend. They come and watch mom or dad get their teeth, or a big brother, big sister get their teeth clean so they can see what it's all about. I think if I came into the room with gloves and a mask, and that might be really intimidating for a child. So the first thing I do is just sit there and chat with them. We don't want that first visit to feel rushed for them, so we'll just sit there and talk to them. We'll talk to mom and dad too. But the biggest thing is to talk to the child like they're a person and they are very aware of what's going on around them, and sitting in that chair can be intimidating and looking at the tools, so we just sit and chit-chat for a little while before we start anything. We do something at our office called Tell, Show, Do, which is exactly what it sounds like with a kid. We tell them what we're going to do, we show them what we're going to use, and then we do what we said we were going to do. I think a lot of kids, it's the unknown that they're afraid of, so if they can see it a little bit before they're in the chair, it's helpful. And of course, if you ever have any questions about your children's oral health, or you just want to talk to a dentist and have some questions, feel free to call the office anytime.